Hi, my name is KK Yeo from the National Heart Centre Singapore. I'm also the editor-in-chief of the Journal of the Asian Pacific Society of Cardiology. And we have been working in this role for the past couple of years since we started in 2021. So the Journal of the Asian Pacific Society of Cardiology began in the latter part of 2021. It was envisioned as a journal for the cardiologists and for the patients of this part of the world, the Asia Pacific. In the past, we have had our top science being submitted to the journals out of the Americas or Europe, and we feel that with the rise of the Asia Pacific, we should have our own general cardiology journal. So this journal will take in papers in any general cardiology and cardiac surgery topics, and we hope that this will make this a journal for the region, relevant to the people of this region, and with the science generated by the scientists and cardiologists of this region. The journal has done well. I think we have had a great interest and excitement by our colleagues in this part of the world. There's been multiple papers submitted and across a broad range of topics. What we really want now is perhaps a larger proportion of papers describing national level data, statistics from registries or audits, or what I would call information that informs us about the practice of cardiology in Asia. We know that in Asia, with a diverse population, with the different stages of economic development, that the practice of cardiology and is very different. The socio-economic, the disease patterns are also very different. So national level statistics would be very important as well. So information such as, say, acute myocardial infarction outcomes, data on the treatment patterns for different types of heart failure would be very important for us in this part of the world. I'd like to add that we also have a special focus sections or issues which may be specific for certain disease conditions. For example, cardiometabolic disease, for example, cardiac surgery. To use cardiac surgery as an example, the disease patterns in this part of the world have slight differences with, say, more developed countries such as the US or in the larger continent of Europe. For example, we might have more rheumatic heart disease here. For example, our the chamber sizes, valve morphologies may be different. And I think there's much that we can share with the rest of the world, what our surgeons are doing here. So special issues or special collections which relate to certain disease patterns, and in this case, cardiac surgery might be important. I think over the next few years, we hope to get the JAPSC indexed in PubMed and to have an impact factor so that the journal contributes to the academic growth of our cardiologists in the Asia Pacific. And I think for that to happen, we need to have submissions in a sustained fashion from not just members of the editorial board, but also from members of our community, such that they see the JAPSC as a viable and an exciting option for them to publish their best science in. I think we should take pride in this part of the world that our cardiologists can generate world-beating science, and this knowledge generation can contribute to the overall care and well-being of patients across the world, not just in the Asia Pacific. Yes, we are definitely looking for, there are certain types of manuscripts that we are particularly interested in. I would say the first is any what we call original research, especially clinical trial data, would be very important to us, especially if they relate to specific Asian populations or relate to largely Asian patients. The second, which I think is really crucial, is what I alluded to earlier on, which is the data from national databases, national registries, national audit programs. And this is because unlike the US or Europe, where there are lots of registries and therefore a very clear description of the burden of disease in these populations, in Asia and in the Asia Pacific, this information is less robust. So we'd like to know, for example, the burden of certain types of health conditions, especially myocardial infarction, heart failure, valvular heart disease, arrhythmias, including atrial fibrillation in this part of the world, their treatment patterns, their outcomes, the gaps, and therefore what can be done to improve outcomes in these patients. I think papers such as what I described would help inform not just the practice of medicine, but also how policy might be implemented to improve the care of cardiovascular disease in this part of the world. So I envision the Journal of the Asian Pacific Society of Cardiology to be important, not just for the cardiovascular care of patients, but also to inform public policy so that overall the health of the countries in this part of the world can be improved.